Hi, everyone. Thank you so much for joining. I'm pleased to welcome Adrian Palau-Tejeda. He's the Diversity and Inclusion Fellow for EveryLife Foundation for Rare Disease. EveryLife is an organization dedicated to advocating for impactful, science-driven legislation and policy that improves the lives of those with rare disease. Adrian began his outreach in the streets of Milwaukee as a field community organizer in underserved communities. In his role at EveryLife, he strives to develop diverse relationships and resources to establish meaningful connections with a diverse rare disease community. He has been an invaluable resource to us at Rare New England in growing the organization to become more diverse and inclusive. So we're excited to have him here today to talk to us about improving health outcomes and experience for underserved communities using patient advocacy and the patient voice. Thank you so much, Adrian.
Thank you so much. It's really a pleasure to be here. Like Tisha said, my name is Adrian Palau-Tejeda. I'm the Diversity and Inclusion Advocacy Fellow with the EveryLife Foundation for Rare Diseases under the Rare Disease Legislative Advocates Program. And today I'll be speaking to you about the power of the patient voice and how we are improving health outcomes and experiences for underserved communities through diversity in patient advocacy. Really, I think before beginning, it's important to just discuss about by the numbers the experience of underserved communities in the United States and those for underserved rare disease communities. So if we look at Hispanic individuals, Hispanic, Asian, and Pacific Islanders have among the highest instances of mortality from liver cancer in the United States. If we look at Hispanic males of all ages, we can see that specific health risks include heart disease, cancer, stroke, diabetes, chronic liver disease, and chronic lower respiratory disease. And these health risks and community health factors are unique for each major race and ethnicity group in the United States. Health risks and concerns for communities are different from the Hispanic community to the Asian community to the Black community in the United States. And each community in its own way has both disease prevalences and community concerns, either from genetic predispositions towards higher rates of kidney disease, such in the Hispanic or Black community, or systemic disparities that impact health. So we can see this in rates being higher for Black community and Hispanic community in kidney disease and mortality from kidney disease. And since 2000, the number of Hispanics with kidney failure has increased by more than 70%. So this is a growing problem, and it's been one that has existed since there's been diverse communities and underserved communities in the United States. Continuing on this subject, despite Black Americans being twice as likely to develop prostate cancer, only 3% of prostate cancer clinical trial participants were Black between 2009 and 2015. This shows that the issue is systemic and present not only in the health care service, but also in the research and therapy development process. So more than just simply being an issue for health outcomes, it's an issue for research, clinical trial development, access to treatments and cures, and more. And really, from this perspective, the foundation has approached the issue of diversity in rare disease as an issue, as a holistic issue of the total public health and rare disease space, more than simply considering it a policy issue or an advocacy issue. Diversity in rare disease and improving representation for underserved communities is an issue that is present in all aspects of the rare disease community. Continuing on this, we can see that Asian Americans represented 1.7% of clinical trial patient population for at least 70% of total drugs tested in the United States, despite representing 5.9% of the population. Or that almost 2/3 of drug trials prior to 2018 didn't feature any Native American or Alaska Native participants. For major racial and ethnic groups within the United States, these issues and the repercussions from the lack of representation can be pretty severe. Medication that may work for certain communities, or even from, for certain communities may not work as well for others. Looking at female patients, for example, it's more likely to take longer time to be administered an opioid painkiller following admittance into the emergency room, measured in dozens of minutes. So these issues are prevalent, and they are long lasting in their impacts for underserved communities. Continuing on this, only less than 8% of clinical trial enrollees are Hispanic, even though Hispanics comprise 17% of the population. Considering the fact that we have 44 million Spanish speakers in the United States who are either bilingual or Spanish predominant, issues like these are incredibly poignant and important to consider when we discuss improving health outcomes and representation for underserved communities. The COVID pandemic created more hurdles for rare disease patients and communities of color. From minority communities are an increased risk of COVID-19 fatality, and for LGBTQ communities, health services experience further strain and personnel reassignment. For underserved communities, whether it's from racial and ethnic minorities to the LGBTQ community, or for those who rely on rural health services, the COVID-19 pandemic has played a further role in affecting underserved communities, complicating existing health disparities and further increasing the need for greater representation and outreach to these communities. So understanding what the challenges and barriers being faced by underserved communities and the unique expressions of these disparities, from there we really understand the importance of increasing outreach and representation within the rare disease space. Communities that face barriers and challenges in accessing basic healthcare or in traveling out of state for their health services have experienced worse health outcomes, especially in the rare disease space. It's been shown through our burden of rare disease study that rare disease patients will experience dozens of events along their diagnostic odyssey, from general practitioner visits to specialists and out-of-state care and emergency room visits. In all of these different events and moments in the diagnostic odyssey, underserved communities may face greater barriers. So what's changed? What are the takeaways for the EveryLife Foundation, and how are we addressing the need for increased diversity within the rare disease space and improving health outcomes for underserved communities? Well, really, before starting, we really needed to understand that communities need greater focus, events, and a space for their own. From this and building on our underserved community relationships, we created events like the Diversity Roundtables at Rare Disease Week, bringing together diverse speakers into existing programs and creating greater integration within the existing framework within the EveryLife Foundation. We knew that we needed dedicated space to underserved communities to discuss the issues and intersections between minority health concerns and underserved community health concerns and rare disease public policy. So really understanding that these issues are incredibly poignant and important, pressing, we wanted to be able to address it directly with the rare disease community by bringing together key opinion leaders and experts in the field. Understanding that if we're going to create further relationships and strengthen the community, we need to meet people where they are and really, create a room for one's own. Really, the lessons learned from the Diversity Roundtable, which was a really great event this last summer, was that empowering the diverse patient voice in the community is something that's incredibly important to increasing health outcomes for rare disease patients of color or from underserved communities. And that planning events, we have to really strive to include diverse people, whether that's in the planning or in the participation. But including diverse people, in our event advisory board, for example, was crucial to ensuring that we created an inclusive event that actively invited diverse participation. It's important to include diverse communities in event planning because it helps ensure our work is representative of the needs and of underserved communities. We really cannot understand the needs of, say, for example, the rural communities if we do not have people from rural communities in our events or in our event planning. The need to empower the diverse patient voice was really an important takeaway. Finding trusted community partners was another one. Finding trusted community partners for our events to empower rare diverse communities was incredibly important. Tapping into underserved community organizations like the Black Women's Health Imperative, the National LGBT Cancer Network, the Sickle Cell Disease Association of America, and others was incredibly important to making sure that we were bringing individuals from from the actual communities we wanted to engage with. In reaching out to our trusted partners, we wanted to make sure that we could establish a go-between and make sure that the interactions with underserved communities and our desire to include diverse communities in the conversation of public policy was done earnestly and with partners from those communities. Trusted community partners can be local or national partners who work in diverse communities and serve as connection points for the communities that individuals want to interact with. So in, an organization or individual's work, wanting to connect more with diverse communities really centers on reaching out to organizations that are in diverse spaces. And these don't have to be national organizations. They don't have to be the Sickle Cell Disease Association of America. They can be a local community board or local community organization. Fundamentally, it's about finding people where they are. And that really serves as one of the central, takeaways. How can we connect with organizations and individuals where they are and in the words and languages that they speak? Building off of this, we really wanted to establish connections for RDLA and making sure that other organizations could really, connect into the diverse space. So really ensuring that these connections that we established weren't simply for, one event, but rather bringing in individuals into the rare space overall. So while organizations like the Hispanic Institute or the Black Women's Health Imperative, organizations like the Hispanic Institute or the National LGBT Cancer Network may not have worked as heavily within, specifically the rare space before, for our, outreach efforts, we wanted to ensure that they were being, welcomed and integrated into the rare space, finding intersections and common interests and goals between the work that we were doing and that they were doing in order to ensure that, this wasn't simply a connection for the one time, and that other organizations could also, tap into the valuable partnerships that we established. And since then, we've really worked to make sure that we're repeatedly, establishing touches and connections with these communities and seeing where our policies can intersect going forward. I think really, the need of saying, what interests, what common goals do we have? How can we work to support you in, the rare space is incredibly important for these connections. And really, I think thinking of everything we do as relationship building, thinking of all the outreach that we as a foundation do as relationship building and community trust earning is important. Really, enhancing the patient voice and improving health outcomes means welcoming and establishing those bonds of connections with underserved communities. Relationship building is the center of all that we do, I think, understanding that in the rare space. From our events. Really, that's why we call it a rare disease community. So outreach to underserved communities relies ultimately on the same thing. Relies ultimately on friendship, common interest, and community. And really, improving the health outcomes for underserved communities relies on ensuring that we address those barriers, keeping in mind the importance of the work that we do and the importance of, the urgency and imperative of underserved community health. But understanding ultimately that the way we can do that is through community outreach and empowerment. More than anything, empowerment and empowering the diverse voice is central to improving health outcomes. That includes building bilingual materials and dedicated diverse outreach and helping partners who are aiming to do the same. Um, you know, Diverse materials are incredibly important because they appeal to underserved communities in the languages that they speak. Admittedly, for reaching out to underserved communities, it's not a simple, leaving a translated document, but rather using the appeal of translation to build dedicated outreach to underserved communities. More than simply translating the documents, it's important to create the documents and then do targeted outreach to specific communities. For example, for Spanish, we can see that, bilingual materials are incredibly appealing to Spanish speakers. And like I cited earlier, 44 million speakers in the United States are actually Spanish predominant. Yet, even translated materials haven't worked in the past for organizations or institutions, even as big as CDC, as big as the census, for example, because they lack the outreach through actual traditional channels to these communities. So it's important more than simply translating materials to do the outreach to communities themselves. And in this way, we can really empower communities because they'll have the same footing and same resources as anyone else. In this way, we've actually really attempted to create dedicated, diverse outreach and ensure that materials that we're providing are available in multiple languages. So it's not simply, translating materials, but doing the dedicated outreach and connecting with our community to learn what translations they need. Providing closed captioning in all our events, reaching out to non-English communities, and really, the central theme of all of this is thinking of it as community building. So when we reach out to these communities and as individuals, understanding that we want to foster connections and make sure that everyone is included and welcomed. And in this way, improving the needs and health outcomes for underserved communities by ensuring that everyone is on the same footing and has the same opportunities. Beyond this, we've built resources and publications for individuals to use, regardless from the rare disease community, touching on diversity, equity, inclusion, and advocacy resources, and diversity and inclusion within your organization. So building on our underserved community relationships to create community-targeted presentations and events, tip sheets and resources, diverse speakers at RDLA, and greater integration within health programs. So ensuring that individuals like yourself or organizations have the tools that they need to reach to underserved communities and to understand diversity within the rare disease space. More than a presentation, these resources can be shared and used by communities in reaching out to individuals and or understanding, the issue more so. For our, diversity resources, we really wanted to establish, what is the state of diversity in the rare disease space and create a functional tip sheet for communities and understanding the imperative of advocacy while also, talking about simple concept of diversity and inclusion within the rare space. Really, creating opportunities for the community to utilize these tip sheets and policy primers to engage and equip underserved communities with the resources that they need. Really, education and empowerment are the center of what we do. So, having tip sheets talk about the importance of keeping track and tools and ensuring that, organizations have goals to achieve, offering, tips and techniques for organizations to use is incredibly important, but also giving them just the resources that highlight the sheer imperative of the matter, giving you, the rare disease patient, the tools to succeed, and giving underserved communities the information that they need. Really, I think this is, the center of what our program has been and what we hope comes out of it, long lasting. It's the empowerment of the, diverse patient voice and the fundamental center of improving health outcomes. And yeah, we really hope that organizations and individuals can keep touch, sign up for our newsletter or reach out to rare advocates. Anyone interested in diversity and inclusion or understanding, the process by which we're going about improving health outcomes or the work that we're doing, please feel free to reach out. We've got a lot of resources that we're developing, more translations every day. And yeah, love to take questions.
Thank you so much, Adrian. That was a really informative presentation. It seemed like, a big theme of your presentation was trust. And I'm curious from your perspective, kind of in community building and now specifically in the rare disease community, what are some of the ways that you can build or maybe in some scenarios repair trust? Like what are kind of some of the mechanisms that you use to do that?
I think the real key to building trust with organizations is just finding common intersections between yourself, your organizations, your work that you're doing, and diverse communities. It's starting the conversation not so much with here's what we're doing, but more how can we help activate your community? How can we help address your community needs? I always use in the language, an outreach language. I never use the words, like we'd love for you to take part in, we love, please come to this event. I always use words, that focus on people first language, and people first outreach, understanding that we're looking to reach out to communities and help empower their patient population and help them. So really, approaching the concept of community trust by reaching out to organizations within communities, trusted partners. So, reaching out to, for example, in Miami, reaching out to an actual clinic for Fragile X, and saying, hi, we understand that you have a community, Fragile X community in Miami for your clinic. How can we help you empower your community? Is there any service that we can provide your institution, your clinic? Is there any way we can work together? So really coming at from that angle of how can we empower your community? How can we activate your community? How can we, work together? I think is really important. Really just address, sorry.
Oh, no, I was going to say absolutely making it, mutually beneficial as opposed to just like, hey, I need information from you. And like, that's the end of the conversation, making it a dialogue and really approaching it from that perspective. You talked about the barriers and challenges people in the rare disease community face, which I'm sure many people on this call, have faced themselves. But what are some of the most, prominent ones that you see and that RDLA tries to address in underrepresented communities?
I would say that the biggest barrier, two ways. Like I said before, in some ways it's policy and advocacy. I would say the biggest barriers in just the healthcare space is unconscious bias from providers, barriers in reaching, care for underserved communities just in, reaching the actual physical locations. If we look at, the availability of genetic counselors in the United States, there's about 5,000 genetic counselors for 318 million individuals in the United States. The rare disease community understands this is an issue, and it affects, everyone. But, in addition, for underserved communities, reaching the genetic counselors that that are there can be even more difficult. Reaching specialists. If you're from a rural community in Oklahoma, reaching that specialist in Texas may be even more difficult. In the advocacy space, it's just about not even knowing that there exists programs or organizations. Reaching out to the National Association of Black Cystic Fibrosis Patients and saying, hi, we have this event, it's Rare Disease Week. We'd love for you to join. We think it'd be a great opportunity for your voice to be heard by, Congress. Just making them aware that there exists an event that is purely, situated to empowering their voice. So I think in advocacy, it's about getting the resources to individuals, getting that knowledge, getting that information to them, making sure that, disparities don't start, disparities start, before the process even begins, but making sure that individuals are on equal footing. But in the health space, there's just a lot. The issues are compounded. Yeah.
Absolutely. So we have one more question here before we wrap up. What can PAG, so patient advocacy groups, do to improve their foundations kind of in this area that you talk about?
Yeah, I think patient advocacy groups can really well, first thing, understanding that it's not a one and done process. Really, like from the diversity roundtables, it's repeated touches to communities, repeated community engagement, earnest and meaningful engagement. Finding those commonalities, saying, "Oh, you're working on this process. We're also working on this." Finding those intersections. For example, next month I'll be presenting at a church. A church group-based health equity conference. The conference is it's a faith-based health equity organization that represents a number of churches for the Black community, and it's hosting a big national conference. We'll be presenting on the importance of patient advocacy for rare disease patients. And we're doing this because we found the intersection between the work that they're doing with, health equity and empowering rare disease patients and the work that we're doing. And being unafraid to say, we have a common interest, and that's the health and well-being of patients and, underserved communities. How can we provide resources for you? How can we work together? So really the biggest thing that patient advocacy organizations can do, beyond diversity and inclusion, techniques like having underserved communities on event planning boards, is find these organizations, do that outreach to local community groups and say, hey, there's, some work that we're doing that we believe intersects with yours. We're focusing on rare disease health. We're focusing on advocacy. We're focusing on health. You're focusing on this, community outreach. How can we combine those together?
Great. Thank you again so much, Adrian, both for, speaking to us today and just in general, all of your help and your partnership with Rare New England. We really appreciate it. Thanks for joining, everybody.
Thank you.